Harlock. Minister, I can't help but despair listening to this debate, in particular some of the opening statements to it. A year to the day since the publication of the Maskey Review into South Kerry CAMHS, and the situation, it remains dire. Vulnerable children have been utterly failed on this government's watch, and your colleagues' chorus of concern is of little help. I note in particular that the Taoiseach and the Taoiseach described the report, and I quote, as concerning and unacceptable. I'd agree, but it's almost like they're surprised. You'd be forgiven for forgetting that both are former health ministers themselves. This government is simply playing to the gallery. You've known about this crisis for years. How many more children have to suffer because of government inaction? And action, Minister, you described today as being unacceptable. How many more reports do you need before you take meaningful action? This is a service which treats some of the most vulnerable children in our society, and still it remains poorly resourced. It is a postcode lottery, and if you find yourself in the wrong CHO, your child, a child, could languish on a waiting list for months, even years, or become one of those lost cases. Is there a more harrowing description of a lost case? These lost cases are cited in this week's damning report, that they are particularly concerning. These are children and young adults with open cases who have been lost to follow-up. In some cases, children who should have had follow-up appointments for review of prescriptions or monitoring of medication did not have an appointment for 2 years. And if that wasn't bad enough, we also know that when some young people reach their 18th birthday, even if they haven't completed the Leaving Cert, for example, they still fall off a cliff. There's no planning, there's no discharge, there's no transition to adult services, no advice about medication, simply abandonment. This brings me to a related issue which impacts the whole health service, but the crisis in CAMHS has brought into sharp focus. That is their IT infrastructure, or their lack thereof. Yesterday, officials from the Department of Health appeared before the Health Committee regarding electronic records, and they did not inspire much confidence at all. The e-health strategy is now 8 years old, and yet we hear that the project is, and I quote, only at the starting line after 8 years. That's scandalous, Minister. How are we still talking about starting lines 8 years later? Why are we so off course? We will never make progress on integrated care without the implementation of electronic records, in 2023. Your failure to modernise our IT infrastructure has major implications for CAMHS. The interim report revealed that 4 out of 5 CHOs visited used paper-based files. That report said these paper-based clinical files were frequently disordered, incomplete, sometimes illegible, and devoid of a logic filing system. In 2023, it is completely unacceptable that most CAMHS team are still reliant on paper and on pen. Aside from making us an outlier internationally and a joke in any sort of modern metric, this is an outdated system of filing that makes it difficult, if not impossible, to follow the care and treatment pathway delivered by CAMHS. This may seem like a peripheral issue in the grand scheme of things, but it's at the very heart of the problem. Another factor as to crisis is the lack of accountability and local decision making. The centralised nature of the HSE is totally flawed. When scandals come to light, everyone is to blame, and most importantly, nobody is held responsible. Last year, we learned that a junior doctor was effectively running the CAMHS service on his own in South Kerry with little or no supervision. That junior doctor should not have been scapegoated for the entire scandal. There has to be accountability for the stunning failure of senior management and of ministerial responsibility. But without serious restructuring of the HSE, that will never happen. We are still waiting for the Minister for Health to implement new regional HSE structures mandated by Sláintecare. Under those reform structures, there will be legally enforceable accountability among senior management teams for failures in clinical care. This radical restructuring will completely shift the balance of power in the HSE, devolving power to local regional bodies. Aside from the clear benefits in terms of accountability, it will provide for more patient-focused services and improve health outcomes, something which is so desperately needed, not just in CAMHS, but across the entire health service. This is a key recommendation in the Sláintecare report, but like so much of the plan, implementation is at a snail's pace, or as it's called, at the starting line. And we have seen it with countless reports. All talk, no follow-through. It's 17 years since a Vision for Change was published. This report detailed a number of deficiencies in youth mental health services, and yet the system remains in disarray. As things stand, staffing equates to just 56% of what was outlined under the Vision for Change guidance on staffing levels. Minister, that is a shameful indictment of not just your government, but successive governments. This chronic understaffing of CAMHS is having a detrimental impact on the mental health of so many children. It is time that this government stopped wringing its hands about dysfunction within CAMHS and actually did something about it. As well as seriously scaling up recruitment, your department and the HSE need to engage in proper workforce planning and move away from centralised recruitment. Due to this model, local services have huge difficulty in hiring the staff they need at the time that they need it. These are things that should have been done years ago, so I would urge you to immediately progress them to address this historic and horrific understaffing. While I welcome the announcement that the National Clinical Lead for Youth Mental Health will be appointed, this process must be prioritised. This was promised in Budget 23 and it is absolutely essential that the recruitment process begins immediately. But this is not the only new appointment needed. There has been no National Director for Mental Health since 2016. You committed to reinstating this post in the programme for government, but have yet to see proof of any progress beyond that. Ultimately, Minister, we need to know that you have the political will to overhaul the mental health services. Behind every CAMHS waiting list figure is a child in need, a child who is being left behind. Almost 600 children were waiting over a year for CAMHS appointment last November. That's an increase of 168% since June 2020. I appreciate that COVID has exacerbated that, but the need is greater, so the will is much matter. We should be treating mental health just like physical health and not allowing conditions to worsen to a point where emergency interventions are needed more often. On every level, it makes sense to fund these services. This chronic underinvestment cannot continue. Our piecemeal system needs root and branch reform because too many children are falling between the cracks. This resistance to change has to stop. The children who are being failed by CAMHS will not get their childhoods back. The Mental Health Commissioner's report may have been interim, but your response must be immediate.
Thank you.